The long-term health effects of alcohol, impaired driving, Part 2. Pancreas injury. The pancreas is a tiny but crucial organ that makes the hormone insulin, which instructs the liver to turn extra sugar into fat, as well as digesting enzymes, which are released into the small intestine. By fooling the pancreas into secreting powerful enzymes into the body rather than the intestines, alcohol is known to harm the organ. The pancreas will start to digest its own tissue instead of breaking down meals. Pancreatitis, or inflammation of the pancreas, is a dangerous illness that may occur from this. You will experience severe abdominal discomfort, nausea, vomiting, digestive problems, and an inability to absorb nutrients from food when the pancreas is inflamed and unable to function correctly. In the long run, severe pancreatitis can result in fatal or life-altering illnesses like diabetes and cancer. You'll pass away if the pancreatic completely malfunctions. Your heart beats 100,000 times a day to circulate blood throughout your body. Without the heart, necessary nutrients and oxygen, as well as waste products, could not be delivered to cells and tissues. The most potent and significant organ in the intricate biomechanical system that is the human body is this one. It depends on your muscles being strong and healthy. The health of every other organ, tissue, and cell in the body will be compromised if the heart cannot operate effectively. Your heart muscle and the rest of your circulatory system are damaged by drinking alcohol. Alcohol causes the heart to beat more slowly, which results in less frequent and powerful contractions. As a result of the slower blood flow through the heart, fat from the circulation may accumulate around the arteries and veins supplying the organ's essential muscle. This may ultimately result in heart disease, heart attacks, strokes, and total heart failure. Regular alcohol use can cause cardiomyopathy, an often fatal condition that is irreversible. The heart will assume an abnormal shape and grow in an effort to make up for the loss of its muscular tissue when this illness manifests. Cardiomyopathy typically results in death, especially when it affects young, healthy individuals, as is frequently the case. Alcohol intake can cause cardiomyopathy in young, active people, who may not even be aware of it until they experience a fatal heart attack. There are several indicators to look out for even though cardiomyopathy sometimes remains undiagnosed. These consist of reduced appetite, extreme tiredness, inability to pay attention, abnormal heartbeat, breathing difficulty. Hypertension. Hypertension, the medical term for high blood pressure, can result from excessive alcohol use. The fragile blood vessels known as capillaries, which link the main veins and arteries to tissues and cells, are subject to increased pressure as a result of hypertension. Additionally, it may stop some essential nutrients from accessing tissues through the bloodstream. Long-term hypertension side effects include injury to the eyes, bone density decline, arterial injury, heart failure and disease, kidney failure and disease, dementia, stroke. Alcohol can impair the synthesis of blood platelets, a condition known as thrombocytopenia, which can have an impact on the circulatory system. Thin blood caused by this condition might manifest as weariness, profuse bleeding when cut, gum bleeding, nose bleeding, and mouth blisters filled with blood. Regular drinkers may also develop macrocytic anemia, which causes the blood cells' ability to carry oxygen to decrease. Shortness of breath, an enlarged heart, an irregular heartbeat, and malformed bone growths are some of the signs of this illness. Lung injury. Drinking alcohol frequently or excessively might harm your lungs as well. Alcohol prevents the healthy maintenance and repair of the tissues in your lungs by slowing down and interfering with normal lung function. This makes you more vulnerable to chronic lung conditions that can be fatal, like cancer, pneumonia, bronchitis, respiratory distress, and lung collapse.